Good morning, everybody. Hope you're having a great April Fool's Day. Happy April 1st to you. Hopefully where everybody is, they can see a little bit of sunshine that's poking out of the clouds. Spring will be here before we know it. So we're super excited for today. This is our second Pelotonia Live. If you joined us last week for our session with Ethan Zahn, hopefully you took something good from that. We thought it was really incredible to hear Ethan's perspective as a survivor and everything that he has learned from being in isolation multiple times in his life, even before this new reality that we find ourselves in. So we're excited to shift gears a bit today and hear from Dr. David Cohn, who's the Chief Medical Officer at the James. He has been on the front lines of preparing the facilities and the staff and just working on a bunch of really incredible projects and new protocols that are going to keep us safe. So I am going to bring Dr. Cohn and Doug here up on screen. Just bring them back up. Where'd they go? Here they are. All right, we've got Dr. Cohn and Doug. Small technical difficulties, but we're getting started. How are you guys today?
Doing great, Jill. Thanks for the intro and the kickoff, and just honored to have David Cohn with us today to give us some insights into what's going on and also answer your questions. I know we have already a few questions that have been entered into the question portal at the bottom as well as on the side panel. So if you have questions throughout the discussion, please add them and we'll get to as many of them as possible.
And it's great to be here, Jill, and I appreciate the opportunity to share what's going on here and to talk about COVID and answer any questions that the community has. Great to be here.
Fantastic. Well, I will let Doug take it away.
Thanks, Jill. David, thanks again for joining us. I mean, I think I'll just start by saying we so appreciate your time. We know how busy you are given everything that's going on. And I want to just start by asking you, like, how are you doing? How are you handling sort of everything that you have on your plate right now? And how are you managing through?
You know, it's really a surreal time for everybody across the world, across the country, in Central Ohio, and obviously at the James as well. And so being in healthcare, it's really a unique opportunity to see this from the inside. We're doing great here. And I think that that's a really important message, is that right now we're in planning stage. We're caring for patients who have COVID. We're caring for patients who have cancer. We're caring for patients that have cancer and COVID. And all during this time, we're preparing for what we're expecting for an increased number of individuals that come in over the next few weeks that are going to have COVID as well. So we're hanging in here. I think we're actually doing remarkably well overall. And it's great to have this lead time to do all the preparations that's going to keep our community safe.
Absolutely. Do you mind giving everybody in the community just a little bit of insight into your role? I mean, obviously you are a gynecologic oncologist by training, you're a scientist, but you're also the chief medical officer. What does that mean? And sort of how do you spend your days ordinarily and also during this sort of time of pandemic?
Sure. So a couple of years ago, I took on an administrative role within the James Cancer Hospital. That's allowed me to work on setting the strategy for the delivery of cancer care for our patients. So you can think about it that I oversee the care that's delivered within the walls of the hospital, within our outpatient clinics as well, and in the community. So overseeing the physician practices, collaborating with our nursing leadership, our staff leadership, and our administrators as well. So it's just my days are generally spent setting strategy, talking about what we can do to deliver the best care possible at the highest level of quality and the best outcome for our cancer patients. That's one thing I do. The other thing is, working with our community partners, Pelotonia being an incredibly important one. And so I don't forget to do it about a dozen times. Thank you, Doug and Pelotonia, for everything that you all do to help with our cancer research initiatives, because my other job is to collaborate with our scientists and make sure that our clinical mission helps to drive some of our research, and that research circles back and drives what we do clinically. So it's sitting in the leadership team of the cancer program is a really big honor for me to be able to do what we do here. And then obviously with COVID-19 in response, that's become even more important.
Well, you do it really well, and having spent time at many cancer centers and across the country and around the world over the years, I can tell you that there is a feeling that you get at the James, and I think that starts at the top in terms of the way our physicians and the way the clinical teams take care of patients and their families, and that's not something to be taken for granted or overlooked, and I'm sure at this time it's even more critical. So thank you for everything that you do. You mentioned earlier that you feel prepared. And I think we all have come to realize that we live in a state and in a city that has taken some pretty dramatic actions early to ensure that we do the best that we possibly can. And so can you talk a little bit about that preparation and sort of how you and the team have handled the sort of new, not so normal that we're operating under right now?
Yeah, I think that's a great description, the new, not so normal. Every day is different. And here's the way I would describe it is that we have some period of time before, what people talk about the surge, which is the large number of individuals that are going to be needing medical care because of COVID-19. And so the longer that we have between today and when that surge happens, the larger the opportunity that we have to do all the preparations. And so for anyone who's, accessed the news or listened and seen what's going on in New York, in Italy, as examples, you recognize that these healthcare systems have been overwhelmed. And the reason why that is probably is because that timeline between when they started preparations and when the surge happened was compressed. So Dr. Amy Acton, the director of the Ohio Department of Health, has talked about flattening the curve. And what that in general concept means is that the fewer individuals every day that are diagnosed with COVID-19 that need medical care, the longer we have until that surge occurs. So rather than a curve looking like this, if a surge looks like this with a lower peak, we're going to have more time to respond in advance to make sure that we have all the medical facilities that are necessary to care for patients, to make sure that we've got all the beds that are necessary, to make sure we've got the critical care equipment as well. And so the proactive steps that Mike DeWine, our governor in the state of Ohio, has taken have been really, really important, so that today the number of cases that we have is estimated to be about 1/5 of what it would have been had we not instituted these changes just a month ago. And when you reflect back and think that it was merely a month ago when the governor made some controversial decisions to limit visitors to the Arnold Classic and how that was thought to be very aggressive, you look back now and say that that probably saved many lives, and it saves the healthcare system the opportunity to prepare for what's to come. So that's what the preparations look like today. It's going through exercises day and day and day to make sure that we're prepared for when we have to execute on our on the plan to care for many more patients with COVID-19 than we have right now.
Yeah, it's great to hear. It's interesting. Historically, a lot of politicians have said that they rarely get credit for prevention, because if you prevent something from happening, it's hard to sort of explain that before something takes place. So we are fortunate in that regard. You won't admit this, but you also happen to be a very talented cyclist who has participated in every single Pelotonia, and we're appreciative of that. Our community is filled with patients and survivors and family members and loved ones. What can you tell us about the care that continues to be given and provided to people with cancer today? I know there's been a lot of question about not having visitors and not having the ability to have sort of more elective procedures, but I know you've told us that people who are diagnosed and who need care are still getting state-of-the-art cancer therapy during this time.
Right. And yes, I deny being a cyclist of any quality, Doug. Here's my take on how to approach the discussion about what care is being delivered to cancer patients. I think most importantly is that care that needs to happen is ongoing. And when you think about cancer patients, cancer care has to keep going, because we've got the responsibility to our patients to maximize their survival, improve their quality of life. And so whenever we're thinking about what care looks like, we've got to ensure that we're in a position of guaranteeing that that type of care is ongoing. And so there's a lot of discussion in the news from the Surgeon General and from the governor in the state of Ohio and many states about canceling elective surgeries. And I think it's really important to know that cancer surgery, by and large, is not elective. Things that need to happen, happen. Chemotherapy that is intended to cure patients of their cancer, to improve their quality of life, to diminish suffering, those are things that still have to go on, and they are going on. But in order to do that, we've got to make sure that we do it in a way that's responsible to our patients, responsible to their families and friends, responsible to our staff, and responsible to the faculty that are delivering this care. And Doug mentioned the visitor policy. So most hospitals around the state and around the country have gone to a really, really hard position of accepting no visitors within the walls of the hospital, except for in really unique situations. As it relates to cancer, for those individuals that are having really difficult conversations at the end of their life, there are visitors that have to be part of those conversations, and that's a very appropriate exception. Short of that, though, there's no visitors in our hospital because we want to make sure that those individuals that come into our system who may have COVID-19 are not infecting our staff, our faculty, and our patients. And likewise, at our outpatient facilities, we also have severely limited our visitors. We're making sure for the same exact reason that we're not in a position where we're going to have an unexpected infection that could limit the ability for our staff to take care of our patients or for our patients to become ill as well. So things that are necessary are ongoing, but they're done in a different way. And I think that what I've learned about COVID-19 and how it affects our patients and affects our staff and our faculty is that there's trade-offs, and there's trade-offs every single day. And so we're trying to navigate a really narrow ledge. On one side, it's the outcomes of our patients. On the other side, it's the outcomes as it relates to COVID-19. And so we're walking that narrow line. I think we're doing it remarkably successfully at this point in time. It doesn't always feel good because to have to say to a family member that they can't be there with their loved one when they're in the hospital a couple days after a surgery, or as they're admitted with a complication from cancer or cancer treatment, that's really challenging. And nobody wants to be in that position. But this is our new reality. And this is the trade-off that we've decided to make to maximize that balance between our patients' outcome and their risk for a COVID-19 infection, and their being with their visitors, families, and friends as well. So not easy. And we're all looking forward to the day that we can go back to our previously normal and not our new normal.
Right. Absolutely. So I'm going to ask just a few quick, additional questions, and then we've got a bunch of questions from the community that I want to get to. Let me give you just one chance to once again emphasize what each of us can be doing today to help not only ourselves and our families, but to help flatten the curve, so to speak.
Yeah. We all sound like broken records in many ways, saying the same thing over and over and over again about what to do. And that's because it's true. And so hand sanitizer, I think that most importantly, it is the principle of decreasing the risk for getting COVID-19 infection. Because the fewer individuals that have COVID-19, the fewer individuals that will subsequently get it from you. And then that chain will continue. So that's the flattening the curve, having fewer individuals in our community that get COVID-19. So wash your hands with soap and water. It's always around. If you don't have that, consider hand sanitizer for whenever you need it. Distancing. So the physical distancing is really, really important because if you're with your core family, you know them, you've been with them through this entire process. Once you start to get individuals from outside of your core family in the mix, then there's the risk for transmitting infection. If they've been somewhere, they've been exposed, they may or may not have symptoms, you get infected, you give it to your family, they give it to others. And that just continues down the line until we have that peak that we don't want to have. So common sense things, if you're feeling ill, don't see other people, take care of yourself, minimize the risk for infection with soap and water, hand washing, and then hand sanitizer if you don't have access to that as well. Obviously, we need to shop, we need to eat, we need to do all these things, but do it as responsibly as you can to make sure that you're not putting yourselves or others at risk. And I think, Doug, the last thing I would say is that that's what we can do, is that it's not so much that you or I would get COVID-19 or anybody in the community would get COVID-19. It's the responsibility that each one of us has to make sure that our community doesn't get COVID-19. So if we all do our part, then our community is going to be healthy, and then our cancer patients will be healthy, our staff, our faculty will be healthy, and we'll get through this a lot more quickly as well.
Very, very helpful. And while it does sort of sound like a broken record, we need to kind of constantly hear it. And I think as time passes, we need to not let up in terms of these actions and sort of double down. We heard our good friend Sanjay Gupta the other night say, act as if you have it. And if you think that way, then you wouldn't sort of be as inclined to spread it. Let me ask you one more question, and then we'll open it up. Lots of things happening in cancer research, and obviously the Pelotonia community is so committed to that research. What can you tell us about what's going on now looking at cancer research and COVID-19? And is there any overlap or any sort of leads or projects that you're excited about on that front?
Yeah, so there's a lot of things that will improve the health of our community that result from innovation. And so whenever we talk about cancer research, we talk about these incredible innovators that are here at the Ohio State University Comprehensive Cancer Center and at the James. We never thought that we would be in this position, but it allows us an opportunity to kind of think outside of what we typically do. And what we're recognizing now is that there are actually medications that are used for other purposes that might have efficacy or can help in the treatment of COVID-19. And so we're doing that research right now. We're looking at our currently available cancer drugs and seeing whether these could potentially be appropriate for the treatment of COVID-19 patients, so that the chance of somebody who has COVID-19 doesn't end up with a severe complication as a result of it, or even die as a result of it. So that's really exciting. I would obviously mention, Doug, is that your leadership in committing $1 million of fundraising from Pelotonia to COVID-19 and cancer research is really spectacular. So this is going to allow us an opportunity to really start to think about things just in this pandemic, but also to prevent future pandemics, or to think about how to more effectively treat viral infections that may occur in the future as well. So there's a ton of innovation that's ongoing here as it relates to cancer and COVID-19. And I think the reason why that's important is that cancer patients have a really unique position when you think about COVID-19, because you think about cancer and cancer treatment reducing somebody's immune system, and it's that immune system that has to fight off the virus. And so cancer patients are more susceptible, it seems, to contracting COVID-19. And cancer patients are also more susceptible to complications from COVID-19 for the same reasons. So the more we understand about the relationship between cancer patients and the treatment as well, I think is really important to maximize the health of our community. And so thanks again for Pelotonia for leading that charge and committing those dollars for COVID and cancer research.
Well, happy to do it. And this community, as you know really well, wants to do anything and everything we can to support you and your colleagues. Obviously, we also committed our merchandise sales to support the staff. We know you are working around the clock, and I think we're all waiting to help in any way. So don't ever hesitate to let the Pelotonia community know what we can do. Quick last question, I promise, and then we'll get to the questions that everybody has. But what's your favorite memory from Pelotonia? You obviously have ridden every year. I've seen signs with your name on them, thanking you for saving a family member or a loved one, which must be emotional for you as you ride through the streets of Columbus and beyond. What's your best memory?
Yeah, you brought up one of them already, and over there in the corner of my office, you can't see it right now, I actually have the photo frame that said, "Dr. Cohn, thank you for saving my life." And when I rode by that sign, it was like written, basically in crayon on a piece of cardboard. It was one of the most poignant moments of realizing why I do what I do. And so to recognize that the research that's being done here at the Comprehensive Cancer Center and at the James that actually impacts patients and helps to improve their outcomes, whether it's improving their quality of life, decreasing their suffering, or improving their survival, is so critically important. And we do it day in and we do it day out. And sometimes it helps to have that reminder of why we do it. And so that to me is really special. And it just goes to having people on the sides of the roads cheering with funny signs, going up ridiculously steep hills with some encouragement at the top and sometimes a beer is really, it's a pretty special experience. And I've been really honored to have done this with a variety of family members and friends through the years as well. And so exposing them to the Pelotonia community has been really special because everybody takes something away from this. And Pelotonia is something I look forward to every single year. I was never a cyclist before Pelotonia, and I became a cyclist because of it. And just thinking about the impact that it has on the community in Columbus, in Ohio, in the country, and across the world, in terms of health and wellness has really been, I think, so important for us. And Doug, I'm going to go back to the previous question you had about, Pelotonia and support for cancer. I just want to say that beyond your commitment of $1 million for this purpose, beyond the committing the profits from merchandise sales for the frontline healthcare providers, but also the Pelotonia's community posting the videos of support for the frontline providers of healthcare was awesome. And it was so special to wake up in the morning or to go to bed at night and to see the recognition that we're being provided. It helps us to do what we do day in and day out. So that was really appreciated from the entire Pelotonia community. Thank you for that.
You're welcome. Much deserved. Okay, let's jump into some questions. So there's a question from one of our community members about ibuprofen. And something that's been in the news reported is that ibuprofen might have some counter interaction with COVID-19 or might make the situation worse. Anything you can share on that front?
Yeah, really early on in the information that was gleaned about COVID-19 was a really small study that was put out that said that ibuprofen, which is a type of a non-steroidal anti-inflammatory medication, negatively impacted the outcomes from COVID-19. And it was thought that maybe it was because of some inflammation, anti-inflammation, some lung injury. Subsequent to that, that was shown to not be the case. And so the answer to that question is there's no problem taking ibuprofen if that's something, or any non-steroidal medications, if that's a medication that you're able to take, that there's no other reasons why you shouldn't and that you need to take it. There doesn't seem to be any adverse outcomes related to a risk of COVID-19 or a risk of complications from COVID-19. But it really does highlight the fact that the pace of information change has been staggering. So what we believe is fact one day can be fiction the next. And so one of the big challenges that we've had is making sure that we're referring to the sources of information that is truth. The CDC, the Ohio Department of Health, to me are some local and national sources of truth to make sure that that information that you might have heard about, just validate that first with a CDC website when it comes to what you can do to prevent yourself from getting COVID-19, what to think about in terms of symptoms or signs of COVID-19, and then also some of the myths that we now recognize are not accurate about COVID-19 as well. But the pace of change is just incredible, and keeping up with it for anybody is hard. So just refer back to those sources of truth is really important.
That's great. Our good friend Rich Moore from the Bay Area wants to know if there's any real correlation between COVID-19 and cancer. And I assume he's asking in terms of both the sort of risk and then also the treatment, which you mentioned earlier.
So, this as a provider of cancer care and as an administrator in a hospital, this is really an important component. And so it does seem that there is an increased risk for developing COVID-19 as a cancer patient. What that translates to is just take care of yourselves. Everything that we talked about, hand washing, soap and water, hand sanitizer with at least 60% alcohol, social distancing, and making sure that you're well. These are really important things for anybody, but it's particularly important for cancer patients to minimize their chance for getting COVID-19. And when you say that, it's, anybody that's had cancer isn't necessarily at risk, but those that are currently undergoing cancer treatment whose immune systems are suppressed do seem to be at slightly higher risk for acquiring COVID-19. And so then when it comes to the cancer, the outcomes from COVID-19, how cancer affects that, there also does seem to be an impact where really small studies out of China have demonstrated that patients who have cancer do have a higher rate of complications from COVID-19 than counterparts that have a lower risk. And so it's not just cancer, it's any chronic condition that weakens immune systems, chronic lung diseases as well, solid organ transplant without cancer who are on immunosuppressant medications. There's this group of patients that have a higher risk of complications, and cancer is amongst them. So it just gets back to do whatever we can to minimize the chance of individually getting COVID-19, and that'll also decrease that chance of spreading it within the community as well.
Very helpful. So another question we got from Bud Abraham is really around our staff at the James and Martha Morehouse and the Spielman Center and the ambulatory centers. Are they receiving the same personal protective equipment as the broader team at the Wexner Medical Center that might be specialized in infectious disease, and sort of how are you taking care of the team?
Yeah, that's a great question. And this is one of those other things that the data changes so quickly. At this point in time, the Wexner Medical Center, which includes the University Hospital, the Ross Hart Hospital, so on, the James, and all of our ambulatory centers, we're following the exact same policy. And these are policies that are put forth by the Centers for Disease Control and Prevention, the CDC. And so at this point in time, if a patient interaction requires some type of personal protective equipment, whether that's a mask, a face shield, gloves, a gown, that's consistent whether it's at the cancer outpatient center or whether it's within the hospital walls themselves, and whether it's the James or not the James as well. So I think that we're all aligned together, following in the footsteps that's recommended by the Centers for Disease Control and Prevention. And we watch every day to see changes that may come up. You'll hear more information. Yesterday, the director of the CDC 2 days ago put out a communication, that maybe the communities should be wearing masks, and the CDC and the federal government is reviewing that. There's other discussions about whether healthcare providers should be wearing protective equipment more than we are, and there's ongoing discussions about that. But these are all public discussions that are ongoing. The Wexner Medical Center and the James altogether are following the CDC's guidelines for the protection of our healthcare workers and protection of the patients that we serve as well.
Awesome. Great to hear. Jim Coleman has a question which I think applies to both patients but also healthcare providers. His question is, how can we help patients who feel isolated right now, who may not be surrounded by as many people and maybe quarantined in some respect? Any advice or guidance both for the patient as well as the family and caregivers?
Yeah, I got a lot of information from Ethan Zahn's Pelotonia Live presentation last week. I mean, I was struck with his comments about what it was like as a cancer patient having received a bone marrow transplantation twice in that isolation, and then to be on Survivor and that isolation, and now to be quarantined or to be isolated with physical distancing where he lives. And so he provided us with a lot of really important guides about what we can do individually if we're at home. And I think it applies to cancer patients as well. So maintaining some type of a social interaction. And I think that in many ways, the social distancing is not the right term. I think physical distancing is really important. Social distancing, this is great social interaction right now. The more we can do this, the better. So keeping engaged with our community, keeping engaged with our friends and family. I think I've had more Zoom meetings in work and out of work than I've ever had before, connecting with friends that I haven't seen in a while, connecting with large groups of college contacts. So these are really important things that we all can do, whether you're in the hospital or not. When it comes to hospitalized patients, though, it's really hard because sometimes they're not feeling well enough to do that. So I just distributed from our local community a number of letters that were written by my friends and family for our cancer patients, and had our volunteers deliver them to some of the patients just to say, we're thinking of you. We recognize that you can't have visitors at this point in time, but hopefully this will go a little way to get you through what you're dealing with. All of our patients have tablets as well that have the opportunity for video chats. And so working within technology, ensuring that we're connecting with that our patients are connecting with their friends and family and allowing them that opportunity is really huge. And like Ethan said, there's a lot of opportunity for meditation, for mindfulness, for exercise, for wellness that we have to practice. And again, this is true for being out of the hospital. I'm sure a whole lot more challenging for many people that are in the hospital, but doing what we can to get through this as a community is really important. So supporting our cancer patients is key. And I think that's a great thing that the Pelotonia community has done for the healthcare providers and continue to do for the patients that are in the James is really important. So
it's a good segue. What are you doing for your own personal well-being? I mean, obviously you're working long days, long hours. What are you doing for stress relief and exercise?
I was hoping today to put a t-shirt on for the first time in a while. I wear a Pelotonia t-shirt, but I didn't have time. So I got this arrow instead on. That would have helped me a lot to kind of put myself back in a different frame of mind. But to me, it gets to mindfulness, recognizing that what we do is so important, the responsibilities that we have to the community and to ourselves and our families. So whatever we can do to be mindful is really important. There's access to certain apps that have allowed free access for this 30 whatever number of day period. I would encourage everybody to use that. I have not done as well as I'd like to, but intermittently I've tried to use those apps for some meditation time. I think the other thing is exercise. I'm a very avid exerciser, and I made a commitment to myself that would not fall off. It does mean that my long days get longer, but I'm able to spend those long days because I'm able to interact and exercise. I had one outdoor cycling ride last weekend with some colleagues and friends, and it was really funny because the benefit of drafting where you're right behind the cyclist in front of you has gone away. So individual cycling, so my fitness is my fitness. I don't benefit from the training of others. So physical distancing on the bike is really important, but it's so cool to see people outside walking their dogs, running, cycling, just being outdoors. It's spring, it's beautiful, and we can appreciate where we are. And I think this, and make the last comment is that it gets back to the fact that we are in a really good spot here. There's not panic in our hospitals. We have this preparation time. And so appreciating where we are and appreciating the responsibility that we have to minimize the chance that peak number is going to be, it doesn't have to be as high as it otherwise would be. Think about that responsibility, go outside and enjoy it and do so safely. And I think we're in a great spot now and we'll continue to be so.
That's awesome. Well, you touched on so many important topics there about stress and exercise, and you shared the funny story of riding last weekend when it was wet and the water that was streaming up from the person in front of you definitely kept you 6 to 10 feet away, which is important. I think this idea of physical distancing versus social distancing is so critical right now. And Pelotonia has always been about bringing people together. And while we can't gather physically right now, there are so many ways that we can engage with our family and loved ones. Let me just end with this final question before we wrap up. And I want to be respectful of your time because you have some very important things to manage. But Kathleen asked, what can caregivers do that are caring currently for somebody who's in treatment, because they are going to the grocery store, they're providing sort of a lot of support, and they want to do so in a safe manner to make sure that they don't negatively impact their loved one?
Yeah. So that's a great question. And it's something that we hear on a regular basis as well. What can you do as a caregiver of somebody who's at home, not in the hospital, who needs to continue with their daily activities, but they're limited in their ability to do so because of their cancer and they're being careful? And I think that actually answers the question, which is that whatever we can do to help our cancer community that's not in the hospital is really key. So check in on your neighbors, say hello. You can bring them meals. That's not a problem at all. You can help to shop for individuals. If you're a caregiver yourself, be smart about it, which means wash your hands before you go in there. Sterilize your cart with the wipes that are being provided, use hand sanitizer. I think that the important thing is that there's been a lot of talk about whether or not bringing things from the outside, whether it's carry out food or whether it's groceries into the house, can carry the risk of contracting COVID-19. And it seems that the answer to that is no. as long as you're doing the things that we just talked about, washing your hands, using hand sanitizer as well. So shopping for individuals who have cancer does not pose a risk. You don't have to leave your groceries or packages outside for a number of days, weeks, or hours. You can do your normal things. And as long as you're washing your hands and making sure that you're not contracting anything from the community, then you're doing everything you can. But just maintaining that social contact with our cancer community to see what's necessary for them is really, really important.
I think it's a great point, and it's something we've been talking a lot about at the office, not at the office, but on our Zoom calls, because, Pelotonia has been the recipient of so much tremendous generosity over so many years, and now's the time for us to all consider how we can support those who have supported us, and that starts with local restaurants and providers and businesses that have been so generous, again, over such a long period of time. So I want to thank you, Dr. Cohn. I want to thank everybody at the James. I hope you will convey to everyone you work with our gratitude and appreciation, both on the work you're doing to help people with cancer, but also as it relates to COVID-19. And I want to also thank our team at Pelotonia, who continue to go above and beyond. We were able to open up our warehouse last week and donate much of the supplies that we had stocked to more than 10 social service organizations. Obviously, the merchandise, profits that are being invested in the research fund, and there's more to come. But now's the time for all of us to do anything and everything we can to support those in need. And we're beyond grateful to be partners with you, David, and your whole team. And that continues beyond today's chat. So thank you for taking the time, and we appreciate all that you're doing.
It's my pleasure, and truly the partnership is remarkable. I appreciate everything that you've done for the cancer community, specifically the patients at the James, and certainly for the frontline caregivers at the James as well. It is truly appreciated, and we're here for you as a healthcare community, and we're in a great spot. So we look forward to continuing this partnership, and we're in a good place.
Awesome. Thank you both so much for taking the time today. One last question, Dr. Cohn, are you playing any April Fool's pranks today?
I woke up this morning and forgot it was April Fool's, so maybe we'll wake up and have it all be a bad dream. But
right?
I think we're going to keep it on the up and up today. People have enough on their plates at this point in time. So yeah, it's nice to have a little bit of levity here and there in our daily lives. I think that's a great way to think about wellness and resiliency as well. So I got to think about it through the day about who's punking me. So
you should know that on our 9 a.m. all staff call this morning, they told me that you had to cancel for an emergency meeting and weren't able to be on. So that was the joke that was played on me. But I think anything that gets canceled or changed in this day and age is to be expected. So it may not have had the impact that everybody was hoping that it would have had normally.
Well done, team. I like that one a lot.
We try. Well, thanks to everybody for joining today. We're going to keep these up hopefully every week if we can, but it would be really fantastic to hear from you what you'd be interested in us sharing on these live streams, who you might want us to bring up. These screencasts stay live even after we'll pull the video down or we'll end the live stream today. So just where all of you are typing in those really gracious comments, you can continue to share ideas as to what you'd like to see. We are going to continue to update content on our Rise site, which if you click at the bottom of the screen on that green button, you'll be able to go straight there. We're adding there we go at the bottom. We're adding new content every day, new links to local businesses and community efforts that we're really excited to be a part of. We gave an update last Friday about the We're All in This Together program that we have going on with some local partners. We have, as of right now, raised $132,000 to provide support to those in the community. We have a new goal of hitting 150 by the end of the week. So we appreciate any support that you can all give and share your thoughts. But again, thanks, Dr. Cohn, and hope everybody has a really great day.
Thanks all. This is fun.
Bye.
Bye-bye.